My name is Rachel Lytle, and I am going to present the first piece of our evidence-based practice case study. Before we get started, we wanted to really give you a foundation for what we're talking about, which is the pathophysiology, etiology, and the kind of signs and symptoms of diabetic ketoacidosis. Diabetic ketoacidosis occurs as a result of severely uncontrolled diabetes. The body uses sugar or glucose for energy, and what happens is insulin is what pulls the pulls the sugar into the cells and allows it to be used for that energy. Diabetic ketoacidosis, or DKA, occurs as a result of critically low insulin shortage. Insulin shortage equals failure for sugar or glucose to enter the tissues that are sensitive to insulin. These tissues includes the muscle, the liver, the adipose tissue, and other very sensitive tissues in our body. While glucose production from non-carbohydrate sources is blocked in the liver, as a result of this, the tissue that is again sensitive to insulin is starving from the shortage of glucose, and your body responds by increasing a hormone production, which is most times our cortisol, growth hormone levels, and other hormones that our body is needing to compensate for this shortage. When there isn't enough insulin available to use, glucose then promotes the release of hormones, again, like I said, that uses to break down fats for fuel, because it cannot use the sugar that we're talking about, which produces acids known as ketones. Ketones can be used as an energy resource for the brain and the renal system, which most times are our most vital organs. During ketoacidosis, ketones produce more quickly, of course, in the body because we are going into more of an emergent response. If these are not, if the ketones are not reduced, accumulation can lead to metabolic acidosis, which is a medical emergency. Most times the cause of ketoacidosis or diabetic ketoacidosis is infection. And what the PubMed reference used said in 30 to 50% of cases, that is the case, infection. In other cases, Mayo Clinic found that a lot of times if there's an interruption or a miss in insulin treatments, you can find patients that have ketoacidosis. Also, patients that are newly diabetic or newly diagnosed, they are also very highly at risk for diabetic ketoacidosis because they're not aware of the signs and symptoms. Diabetic ketoacidosis signs and symptoms are very similar, or start off to be very similar, as to patients with hyperglycemic episodes. Extreme thirst, frequent urination, nausea, vomiting, fruity like smelling breath, abdominal pain, weakness, shortness of breath, dry skin or dehydration, and decreased flexion, so more fatigue and just kind of sluggish feeling, rapid or tachycardia or very high heart rate, or sometimes very low blood pressure, rapid breathing that ties along with the shortness of breath, and sometimes mental status changes. As we go through the case study and you hear from the other peers of mine in our presentation, you will hear how more of a full case study where ketoacidosis and some of these signs and symptoms that we're talking about, how that happens. Thank you for your time.